are some women who have very large breasts who are uncomfortable in their clothing, they're uncomfortable with their activity level, and they're just uncomfortable with the complications of wearing a very large bra, such as grooving in their shoulders, big huge lines underneath their breasts where the bras are so tight, trying to hold everything up. They may have associated back pain, neck pain, and may even have some numbness or tingling in their fingers. Those women certainly benefit from a decrease in the breast volume and the breast size. But there are also women that benefit from a change in shape of the breast, which also includes a loss of volume. We can take the breast and make it a little bit smaller, but make it significantly more youthful in shape. Taking a nipple that's no longer pointing straight ahead, that maybe now has drooped down after you've had some kids or breastfed or just with age, and we can take that nipple and move it back up, tuck a little of the skin up, and certainly make the breast look more full and look more youthful. Your insurance company wants to make sure that you don't have another problem like a severe neck or back pain for which chiropractic therapy or physical therapy may be good. You can check with your primary care provider first, but if you've tried those other modalities, if you've tried losing weight and your breasts are still large, heavy, and uncomfortable, then you may want to have a discussion about whether a breast reduction is right for you. There are women who only have moderately sized larger breasts, but if they have very physical jobs, if they're required to wear certain types of clothing, a large breast may very much interfere in their ability to do their work well. We do have a lot of girls coming right out of high school and college that have large breasts. They're tired of it. They don't like the teasing that they've had from it. And maybe they're going into a job where they don't want to have a large breast. Many women in the military don't want to have a very large breast to do their physical education classes. And so even some of the younger women are opting for breast reduction. Now we do counsel those younger women that you may not be able to breastfeed following a breast reduction because we do have to cut through some of the nipple ducts and some of the milk ducts, and so that is an issue and a concern. And if you want to make sure you can breastfeed, then have your breast reduction after you've finished having your children. Well, the first thing, of course, is whether or not you might want to breastfeed. If you haven't finished having your children, the next time you're pregnant, your breasts will enlarge with milk, and then when they shrink again, you may have some resumption of the sagging or droopiness you had before surgery. So your benefit won't be as long lasting. So if you finish having your kids, the next thing to think about is the scarring. There's always a scar around the aureola, around the pigmented part of the breast. And then there's sometimes scars between that and the crease below the breast or actually underneath the breast. So you need to think about how well you scar. If you have any trouble with scarring in another surgical site, maybe a breast reduction is not for you. There are actually two different techniques for doing a breast reduction, one of which minimizes the scar, and those are for women who are only going down 1 or 2 cup sizes. For women who are going down much larger, 3 or 4 cup sizes, you need a little bit more scar, including that scar that's underneath the breast. But we reposition the nipple in a higher, more centralized area, as well as make it smaller. And large breasts, the areola may have dilated quite big, and that's not really very pretty, so we make it smaller. And we try to leave the musculature to the nipple so that you can still have a sensate nipple that changes with cold and changes with activity. We then take the breast, we take some of the breast tissue away, including the skin as well as the breast itself, and we will have the pathologist look at that to make sure we're not missing a cancer. If you are a candidate, maybe in advance we'll have you obtain a mammogram just to make sure that there's not any issues or anything we need to specially biopsy when we're in the operating room. These are all outpatient procedures. Maybe a week or so off of surgery, you'll be wearing a surgical bra for a while or an athletic sports bra, and we just ask you not to do any heavy aerobic activity for about a month after surgery to give the breasts a chance to settle down, the swelling to go away, and the scars to soften. After procedure, there's always going to be some post-operative pain. For 1 or 2 days, you may need a narcotic, which we will be happy to write your prescription for. After that, the pain's usually very minimal if you're wearing a nice supportive bra, and you can change to something like an acetaminophen or an over-the-counter non-steroidal, such as an ibuprofen. Longer-term complications, of course, can be that we try to get the breasts as symmetric as we can. But I'm not any better than God, and sometimes if you start out on one breast larger than the other, you may end up with a slight asymmetry. Usually this is camouflaged in a bra without any problems. We've mentioned the scarring already, and sometimes you can have a little loss of sensation of the nipple area. The worst complication we see is if you have a wound healing problem. So we discourage this operation of people who smoke because they never heal quite as well as normal people. And if the suture line were to break open, we just do little local wound care with a topical antibiotic, put a Band-Aid on it, and let it heal up over the next couple of weeks. It comes down to what is your goal. Is your goal to look better in the shirt you have? Is your goal to actually be able to buy a shirt that fits yourself better? Is your goal how you're going to look in a bikini, or how you're going to look when you're naked in front of your lover? Those are all the different goals you need to think about, and then you can think about the scarring, and you can think about the shape and the size you want to be. We can tailor the size just a little bit. We can tailor the shape a little bit with our different operations. And so my job is to make sure that I meet as many of your goals and expectations as I can.